Indonesia, the world's fourth most populous country, is home to nearly 285 million people. Despite being a major agricultural nation, it faces persistent food insecurity. Indonesia struggles with its rapid population growth, shrinking farmland, and rising agricultural costs. Food insecurity is a multidimensional issue tied to the entire food system, from production, processing, to distribution and consumption. Climate change threatens rice yields, low crop diversity and poor storage increase food prices and cost forage. Transportation and infrastructure gaps limit accessibility in remote areas. Diets remain rice-heavy, leading to nutritional deficiencies. Indonesia is on a mission to achieve zero hunger, the second Sustainable Development Goal, ensuring everyone has access to safe, nutritious, and sufficient food all year round. In 2023, Indonesia ranked 78 out of 166 countries, with a score of 69.43. Progress is being made. Hunger is stunning in children under 5 has significantly dropped, while agricultural output is rising. To fight malnutrition, the Free Nutritious Meal Program launched in 2025 aims to feed 90 million children and pregnant women daily. Programs like Easy Feeding Group promote balanced diet intake, while UNIDO help farmers to adopt sustainable practices. Yet, challenges remain. Standing and wasting in children is still high, reliance on animal-based food continues, and nitrogen management is poor.
We often talk about food security, but what does it really mean? According to the Food and Agriculture Organization, food security exists when all people at all times has physical and economic access to sufficient, safe and nutritious food to meet their dietary needs and preferences for an active and healthy life. Food security is built on 4 pillars: stability, utilization, availability, and accessibility. Today, let's focus on one pillar that's often overlooked: food utilization, which is about how well people use the food they consume for health and nutrition. In Indonesia, even when food is available and accessible, many people still aren't getting the nutrition they need. The country is facing a double burden of malnutrition, where undernourishment coexists with rising rates of overweight and obesity. In 2023, over 23 million people couldn't meet their dietary needs. The key issue is, nutritious diets are not affordable. A healthy diet costs 2.5 times more than a basic staple-based diet. Urbanization has shifted food demand away from rice, but local production hasn't diverse enough to meet this change, causing high prices for nutritious food. On top of that, there's a lack of nutritional knowledge. In many households, eating still means eating rice, lacking protein and vegetables. Snacks like meatballs, chips, and sugary drinks are commonly consumed, while healthy options like milk are underused. Furthermore, even if incomes of farmers increase, they are growing fewer food types, and their own diets are becoming less diverse, especially lacking fruits and vegetables. So, to achieve true food security, we need to go beyond just food availability. We must ensure that people understand, can afford, and choose to eat the right foods to nourish themselves and their families.
In Kenya, AI is helping to combat child malnutrition in powerful ways. One key innovation is a prototype dashboard that visualizes regional malnutrition risk, enabling policymakers and health workers to take quick and efficient action. Another breakthrough is the MEMON system, the method for extremely rapid observation of nutrition status. It uses simple facial photograph to estimate body mass index (BMI) in adults and wait for health Z score (WFZ) in children under 5. In Indonesia, AI is also used in creative way. Flexible app detect image of Indonesian food to estimate nutrition by using convolutional neural network (CNN). Indonesia also runs the EPB GPM, a national nutrition information system that records weight, height, and overall nutrition status on children under 5, teenagers, and pregnant women. With AI algorithms, the system helps track stunting, malnutrition, and obesity. To address malnutrition effectively, it is essential to rely on accurate, timely, and comprehensive data. One of the main database used is the District Health Information System 2. However, DHIS2 has notable limitations. It collects data only at health facilities, potentially missing children who can't access medical care. In Indonesia, the FAO WHO Global Individual Food Consumption Data Tool, or GIF, is used to study food and nutrition patterns of lactating women aged 16 to 42 in rural areas. Its limitations? The data are often collected only in specific areas such as rural or urban zones, and may not provide a nationally representative picture. The Indonesian Health Survey 2023 offers a more comprehensive approach. Still, the survey had gaps. Data could not be collected in rural due to security issues and bad weather.
After exploring the databases, it's time to introduce our AI model that recommends region-specific food fortification strategies to address macronutrient deficiencies more effectively. But first, what is food fortification? Food fortification is the process of adding essential nutrients to food during food processing. In Indonesia, fortification is already mandatory for salt, wheat flour, and palm cooking oil, guided by standards like SMI 3751. However, challenges remain. Data on coverage and impact of fortified foods are limited. Region needs are poorly understood, and coordination among stakeholders such as food fortification factories and logistic companies is weak. Most strategies are often one-size-fits-all, so how can we make data-driven decisions about what to fortify with which nutrients and where? That requires 4 key types of data: regional nutrition data, food composition data, regional consumption patterns, and data of nutrient impact on health. Unfortunately, existing databases are incomplete and outdated, especially on regional consumption and non-vitamin A deficiencies. To address this, we explore solutions like crowdsourcing household nutrition and food data, expanding survey scope to include more micronutrients, creating synthetic data sets using AI where gaps exist, using market sales and distributor data to estimate consumption patterns. With these inputs, we developed an AI model powered by a random forest algorithm which uses supervised learning to generate predictions. We input variables like regional nutrient deficiency rates, nutrient content in staple foods, regional staple food consumption patterns, and the cost of fortification per nutrient. By analyzing these factors using decision trees, the model outputs a fortification priority index. It classifies food nutrient combinations according to their suitability, which are scored through regression analysis.
Even when fortified food is available, inefficiency in the supply chain may degrade the vital nutrients. This is where the Internet of Things IoT comes in. Sensors can monitor storage and logistics in real time to preserve the nutrients. In Indonesia, more manufacturers are already adopting this tool, such as temperature monitors, humidity sensors, GPS trackers, and RFID scanners into their operation. However, data silos and regulatory uncertainty remain major challenges. This is why we propose an AI-powered solution. AI can standardize fragmentized IoT data, visualizing it on automated dashboards in real time and detecting issues. To ensure trust and transparency, we integrate blockchain. This immutable ledger helps stakeholders access real-time data, prevent frauds, and trace every shipment. For example, if IoT sensors detect a safety breach in a school meal delivery, AI can trigger instant payment holds and record the event securely on-chain. There are cases where scammers are using Indonesia's free meal program to cheat caterers. We are here to prevent such cases. We are not starting from scratch. Indonesia Hara platform already tracked farm data. We built on that to add AI for nutrition integrity, scale it nationwide, and fuse IoT with blockchain for full traceability. Just like Walmart of the USA did, cutting traceability from 7 days to 2.2 seconds.
Now I'd like to talk about our 5-year plan for transforming Indonesia's food system. In year 1, we focus on data. We built a comprehensive national data set on crops, soil, diets, and nutrition gaps, filling in with crowdsourced surveys, synthetic data, and retail sales estimates. Year 2 is all about training the AI models. One predicts the best biofortified crop per region using random forest classification. The other, the fortification priority index, matches the right nutrients to the right food for each community. In year 3, we launched pilot programs, testing biofortified crops in various regions and deploying fortified foods in schools. IoT sensors track conditions across the supply chain, while AI ensures nutrient quality is maintained. In year 4, we connect our supply chains through blockchain and AI dashboards to detect fraud, automate verification, and also ensure transparency. Finally, year 5 is about scaling up. We expand nationwide, align with government platforms, and also inform data-driven policies, helping reduce stunting, lower healthcare costs, and also boost productivity. Here's how we'll use the $500,000. Over the first 3 years, 40% goes to year 1 for building a complete national dataset. 36% funds year 2 to train AI models that recommend region-specific crops and also nutrients. The final 24% supports year 3 pilot programs that use IoT and AI to ensure nutrient quality. So, why is this project worth the investment? Indonesia already spent $3.9 billion annually to fight stunting, and it costs up to 3% of GDP. Global AI programs like UNICEF's Rapid Pro show success even in low-resource settings. With tools like EPPGBM and Posyandu, Indonesia is ready to scale. Every $1 in nutrition yields up to $16 in returns. This 500,000 initiative is a smart, high-impact investment in health, productivity, and national growth. Moving on to the feasibility and multi-ministry value of this project. The initiative aligns with national priorities and supports key ministries. For health, it helps reduce child stunting and boost long-term workforce productivity. Agriculture benefits from AI-guided biofortification of nutrient-rich local crops, improving both nutrition and farmer incomes. Industry gains stronger food processing standards and innovation. In conclusion, this proposal is not just about food, it's about the future. It builds a healthier generation, supports farmers, and strengthens our economy. With your support, we can ensure Indonesia's future. Thank you.